I am Allison Rosen. I'm a 10-year colorectal cancer survivor, and I've been an advocate probably for 9 of those 10 years. My advocacy started as a result of me wanting to meet other young adults that were going through cancer just like me, and really trying to help bridge the gap between the scientific researchers and scientific community with the patient and survivor and caregiver community, because I had worked in cancer research at that point for about 12 years. All of a sudden, I started having more fatigue than normal. I started losing weight, and there was blood in my stool. So really, some of these symptoms that I didn't know at the time were colorectal cancer started popping up. My GI doctor did an x-ray. She thought I had something called a blockage. Turned out that blockage was a 13-centimeter tumor in my colon, not letting food move down me. So I had a colonoscopy, which is a huge part of my advocacy. Screening can save lives, and screening did save my life. I was told if I had not had that colonoscopy and my colorectal cancer hadn't been caught at stage 2, it was about to break through the colon wall and I might not be alive today. I ended up with 5.5 weeks of chemo and radiation, a little bit of a break. Then I had my first of many surgeries. I'm working back to get into the best shape that I possibly can. And, I have long-term complications that are manageable. At the beginning, they might not have been, but they are manageable now. My advocacy started really with, I wanted to talk to someone else like me that was going through treatment like me, that was young like me. And so my cancer hospital matched me with another survivor. I talked with them and they really helped me throughout my whole journey. And they also said, you might be interested in this social group where other young adults get together on a regular basis and we do something fun, but also naturally, you're gonna share stories. So I went to one of those events, and after the event, I was told about a young adult advisory council that MD Anderson had. And I was like, yeah, I want to do this. This sounds great. I can help shape what they want to do for young adults at this hospital that I was treated at. And it also was a way for me to give back because I wasn't working in cancer research anymore. I switched more to public health, community outreach, education, again, so I could be out in the community and help use my story and what I learned in cancer research and also in the field while talking to other people to help convince people to get screened. But I really missed the research aspect too because I loved it. So I found out about AACR and the SSP program, and I thought this would be amazing because it is my mission. My mission as an advocate is to help other people within the community, but also help bridge that gap. And this program specifically helps with that. It gives us as patients and the cancer researchers as the people that are discovering what is going to be the next up and coming treatment and what for all of us to bring back to our communities. To work together hand in hand to help shape, I think, cancer prevention, cancer research, cancer treatment for the future. The only way to advance cancer and cancer treatment and cancer prevention and long-term survivorship of cancer is through cancer research. So we need funding for cancer research so we can find the best and most innovative treatments so that people can live longer, happier, healthier lives. The goal is prevention, but if we have cancer, we want the best possible treatment. And the way we get that is through policy to get more funding for cancer research to help save lives. So I really want to empower new patients that are thinking about advocacy to get involved in it, because it's been one of the most rewarding things I've done as a survivor. There's a lot of things that cancer research has brought to my life, but I will say the number one thing is long-term survivorship. And thanks to cancer researchers, I'm alive today, I'm living, thriving, and I will live for a long, long, long time. And that is because of cancer research.